Hello everyone and welcome to week number 6. This week our focus and our topic is going to be assisting with physical examinations and chart documentations. Now part of this is something that we have already kind of worked on in the past. We're just going to kind of be honing in on those skills. So what I want to do is take a few minutes and go over the course objectives for week 6 as well as your homework assignments. So let's start with our course objectives. There are 5 of them. The first one is practice procedures for proper charting and updating of paperwork for established patients. So this week what we're going to be doing is we are actually going to be doing that rooming technique and that rooming skill again. So with that, when we did it a couple weeks ago, you were given some feedback on it, on how to kind of change a few things and make sure that things are documented appropriately. So this week we're going to kind of put those into play. The second objective is apply effective listening skills during a patient interview. Now that again is going to come with the rooming technique that we do, but you need to be able to be listening to your patient so you know the appropriate questions to ask and the right information to document. Number 3 course objective is explain the important skills needed to assist the provider with a physical examination. Now with this, that's going to be knowing the different positions to put your patient in for patient positioning, knowing the different techniques that the provider will be using during a physical examination, and knowing how to properly set up things so that way when the physician comes in to do the exam, they're ready to go. They don't have to wait on you to find materials. Objective number 4 is report on various jobs that medical assistants can hold. Now when we say this, it's not talking about different locations that they can work, but maybe different job titles that they can actually have in the field. Sometimes a medical assistant isn't the universal title that we use around the world or at every company. They might call it something else. And finally, the last course objective for this week is to practice professionalism and time management skills. So a lot of this will come in when we do hands-on activities with your classmates, learning how to speak in a professional manner, but also using your time correctly in the lab and not wasting it by texting or being on your cell phones. So those are our 5 course objectives for the week. Let's talk about your homework assignments. So the first one you have is your Module 6 discussion board case scenario. So remember, for this you are going to read through the scenario that is provided to you and then provide your feedback and details on the areas of professionalism, attitude, time management, and hygiene as they relate to the scenario. Again, if an area does not fit, then you need to make sure that you do just state that in your initial posting. Initial postings need to be at least 100 words in length, and they are due on Tuesdays by midnight. Your reply post to at least one classmate needs to be at least 50 words in length. And remember, when you're doing a reply post, you are reflecting on what your classmate has written, as well as providing your feedback on or your opinions on the scenario. Those reply posts are due Saturdays by midnight. The next that we have here are your Module 6 Mind Tap assignments. For this week, you have one chapter that you are working with. It's chapter 38, but there are 2 assignments for it. The first one is a virtual lab, learning lab on clinical procedures. The second one is a reality check reflection on the complete physical exam. Then you also have your weekly CMA prep test in MindTap. Next assignment is your Module 6 Path assignment. Please remember that you need to complete the Module 6 CMA prep test in MindTap before you do your Path assessment. It asks you on your Path assessment what your score was on your CMA prep this week, what areas it covered, and how you'll learn that information moving forward for the future. So you cannot and you should not leave it blank. So make sure that you do your CMA prep test first, and then you can do your PATH assessment. The PATH assessment is due Sunday by midnight. And that is all I have for you guys. If you have any questions or concerns, please make sure you do bring them to the lab on Thursday. Otherwise, everybody have a great week, and I'll see you Thursday for our lab. Bye now.